welcome everybody. Yes, I have the privilege to chair the steering committee for the Tumour Summits program. Been heavily involved with the program over the years. I believe we've had 13 Tumour Summits previously, but in the last few years during COVID, they've all been virtual. We've planned them to be face-to-face and none of them have come off face-to-face. So this is the first face-to-face one probably for about 4 years. So it's doing it virtually, it's better than nothing, but it's I think the collegiality and getting to meet people across the table and the side conversations and things are really important. So, despite floods, pestilence and pandemics, here we are, which is fantastic. Just on a personal note too, my father actually died from melanoma. He had a melanoma in his eye in the 1980s, and he lived with one eye for a very long time, and then unfortunately got another one when he was well into his late 80s, and unfortunately he succumbed to that. But on a positive note, what we're here to do is to try and make a difference. And the Tumour Summits is really, some of the sort of features of that is that we try and trawl whatever data we can get access to about what's happening in this state in relationship to melanoma. And we get to use those data and we use that to have an informed discussion about what the variations might be in both treatment and patient outcomes around the state to see if we can make some sense of where the strengths are and where the weaknesses are. We want to facilitate a dialogue about the quality of care and the outcomes and try and agree on some priorities for action. From here we will attempt to try and find some very well-defined time-limited and feasible options for things that we can get to work on. It's not really much use to say, yes, we need another $1 billion and in 10 years' time it'll all be fine. We all know the system's not... We know we have an excellent system, but we know the system can be improved. And looking for those improvements and acting on them, potential improvements, is what we're about. So we're also in this supporting the people at the coalface, the clinicians, the nurses and doctors, particularly in allied health staff, to make a difference to how the system works. And then we have the integrated cancer services, which are essentially regional entities involved in improving cancer care. To take whatever comes out from the Melanoma Summit and take it forward and act on it. Now, in the lead up to this, there's been a group formed of interested clinicians, also consumers, in a multidisciplinary working party, and they have looked through the various data analyses and tried to make some sense of where the strengths and the weaknesses are. So in terms of identifying unwarranted variations, we are using a population approach here, so it's not just about sort of one particular hospital or one particular region. We're looking at the whole state. Unwarranted variations is our focus, but sometimes variations are warranted and you have to actually look closely to understand that. There might be reasons for geography or comorbidities or some other issues that mean that the best practice treatment is not possible. And we essentially will look to do local action where needed. If there's a problem across the state, it might be a statewide initiative. If it's particular parts of the state that have particular problems, then there can be some locally focused activities. So in the previous summits, all the summits that we've run have been run much the same way. We've usually attracted around 80 to 90 participants, and generally the participants have rated 8 out of 10 or higher at their experience. And between 85 and 100% would recommend a college to attend. So I hope that the feedback that you give to us, if you fill in our feedback forms, and that will be as good as that or even better. And with no further ado, apart from thanking the team who have been involved in putting this together. So Janine Scott is the manager for the Tumour Summit program. Also Diana Fail, Rebecca Miller, Laurie Cameron, Alera Mitchell, and Linda Nolte, who's the NEMICS manager, who's unfortunately succumbed to COVID yesterday and is not able to be here.